So our final speaker for the day is Kseniia Voznitsyna, speaking on psychedelic-assisted trauma.
Навіть без презентації. Добре. Я скажу не дуже довго, це ви вже трошки всі втомились. Я лікар-невролог за фахом, і я є директором Національного центру психічного здоров'я для військовослужбовців і ветеранів, який належить сфері управління Міністерства охорони здоров'я. Задачею нашого центру є боротьба з
Right now, our task is to fight the unseen wounds, and this is three big things. This is stress-associated disorders, and that's clear, like depressions, PTSD, disorders in adaptation, disorders of the sleep, etc. Second part, we're an experts center and advancement center with a slight skull traumatic brain injury or concussion trauma, because currently in Ukraine during the wartime this is, and I can clearly see it, is a kind of an epidemic, because almost every soldier has a small concussion from the explosion wave, and many of them have 3 to 5 episodes of such traumas, which is characterized by certain disorders. And a third line of expertise, but I'd rather not have it, is working with people after tortures and captivity. All the team has been working not only during the full scale, because I personally started working in summer 2014 when I got my first patient with unseen wounds. And as of now, our experience is 10 years on the go, working only with soldiers and veterans. We don't deal with civilians at all with different disorders or neurological disorders, etc. So I would say it's like dozens of thousands or hundreds of thousands of people wounded by war. And what is our superpower? That's our great expertise, and we know what's working, what's not. Ukraine has a specific context of war. We're waging war on our native land, and our soldiers get a lot of psychological traumas. And if we supported one, the soldier may get another psychological trauma a couple of months later, or a number of traumas. Every family of the soldier is also under danger. Because if we talk about John from America, who fights his war in Afghanistan, and he knows that his family is in Texas in safety and in calm place, our soldiers don't have that kind of knowledge. Our soldiers free up the occupied territories, and they see the deaths not only by the Russian soldiers, which is quite normal for war, but they also see the death of their relatives, of their fellow citizens, which also causes additional stress. And this is also a factor that causes the feeling of the soldier couldn't save that person. And another context of Ukrainian war is comorbidity, when every patient with psychological trauma has an organic damage of MTBI or a small concussion due to explosions. So implementing all the protocols existing in the war, we can't do it straight away in Ukraine. All of these protocols have to be adapted, and we need to see if they work for our context. And we don't have a safe place for the therapy. Sometimes I can hear international partners like, find a safe place to have a good therapy. There is no safe place in Ukraine, even in Carpathian Mountains, to have a therapy session. We are working just in these cases as we can, and in our center, by knowing the nature of a trauma, its complexity, its multifactorness. So we developed a multimodal model of assistance. All our specialists are like universal soldiers. They all know cognitive behavioral therapy, MDR, somatic experience, or dynamica or narrative therapy. And at times we need to select a special yoga, enhanced sleep for veterans, or horticultural therapy, a special mindfulness approach for soldiers. And this is not enough yet. So psychedelic assisted therapy is my topic. And as a representative of a state center of psychological trauma, is an advocate for such type of assistance. Because, you know, psychedelics are the first groups of drugs of narcotic list which is not allowed in Ukraine. But within the last year, the war has catalyzed a lot of processes, whatever hard it is, but me and the team, with the help of public organizations, do our best to enhance this kind of therapy. And during our last conference on psychedelic assisted therapy, I said that against such therapy, a person, only a person who cannot see another person fighting with trauma can oppose such a therapy. And we see hundreds of our men and girls who want to fight their trauma, but of course there are resistance cases. There are cases of deep depression, and that's quite often. There is the people do not respond to cognitive-based therapy because in parallel they have an organic damage to the brain, and there are some cognitive defects that will not help them reflect on some aspects and work out their trauma. So just like soldiers in the front line, they have a lot of weapons, sometimes very powerful, different in kinds. So our specialists on psychological health have a great number of weapons to assist all the people, because every trauma is similar and quite individual for every person, and we need to select a pool of tools or interventions that will be fit for a certain person. So that's not a standard evidence-based approach. This is an evidence-informed approach, which besides the experimental data adds up the acceptance of a patient, the patient's choice on this or that kind of tool of treatment. So that's a partner work. It's not a paternal work when you prescribe drugs, but it's a partnership between the two people. And as of now, out of psychedelics, only one is allowed. This is ketamine. It's not a classical psychedelic, but it has the mechanism to influence the brain, which can be treated as a psychedelic drug. So right now in our center, we've started a pilot project that was the first time in the state establishment when we will provide ketamine-assisted therapy. And this is psychotherapy, first of all, with the help of ketamine, because this course will also include a 3-week inpatient treatment with 3 courses of ketamine therapy, and between them a powerful psychotherapeutic works with MDR method, and maybe we'll add some more tools for individuals. Here we can study only the resistant type of depression because there are international protocols to use ketamine during the resistant depression. And maybe the next year, together with the University of Prague, we'll start a 2-year project, a clinical research on ketamine-assisted therapy of PTSD. This is placebo research, a real research, which will allow us to compare how the ketamine-assisted therapy works in PTSD, because there is no so many researches on impact of ketamine on PTSD. Ketamine is fine for depressions, but it wasn't researched for PTSD. I can't tell you anything about the results because the project is just starting, but we will use all the possible tools, everything that works, to get over the trauma of war. And the philosophy of our institute is the post-traumatic growth. I think you know about this unique phenomena. And alas, the help of psychiatric with giving a person a good drug will not give you any good with post-traumatic growth, because if a person has a trauma, and this is my latest insight, you need to fight trauma with everything you can. Work with the body, with a qualitative psychological therapy, support in community level, support in a family, and support of every member of the society, because psychological help of veteran is a business for all the society. Thank you. Наскільки я розумію, Україна знаходиться в
potential benefit of using PAT and KAT for treating PTSD. Should it look successful, what would the future expanding of use of this look like? Is there a process that clinics would follow to get approval from the government to use these medicines or substances, and how would others potentially be able to get that permission, and how would it be regulated?
Yes, it's a very complicated process in Ukraine of regulation of use of this kind of medical means. Ketamine is the only allowed thing here, but to help us use other psychedelics, like heavy psychedelics, MDMA and others, we will need some legislative changes on the state level, which is quite complicated. But our team and the big team of our international partners and the public organizations, we're working with MOH now, with Verkhovna Rada, the committee of MOH, to advocate these changes and to let our people accept another method of treatment.
And one follow-up question.
Ще
How
одне
have you found the Verkhovna Rada to be receiving your questions, your requests for permissions, your suggestions? Are you seeing that the Ministry of Health and the Verkhovna Rada are generally interested in helping you explore the possibility of the benefit of this treatment?
Ну, це не просто.
Well, that's quite complicated. We're hoping that this will happen, and we're doing a lot to achieve that. We're arranging international meetings, we're providing best stakeholders for MOH, like international representatives, like David Nate from Royal College, Eric Vermeter, a famous military psychiatrist, and we do everything to prove that this approval has to be given. Thank you for your meeting. But in USA, when cannabinoids were legalized, there is a great group of people who are treating PTSD and depression with these, and there is no big data. How about this in Ukraine? In Ukraine, it's more legal and more simple. There is a law on cannabis, medical cannabis has come into force, and luckily, all these speculations over veteran topic that we're gonna everybody treat with marijuana, but that's not true. It's a manipulation because there is a strict regulation from the Ministry of Veterans of US saying that PTSD cannot be treated by cannabis. It can remove some symptoms like chronic pain or anxiety, but this is not a treating method for PTSD. The same applies to Ukraine. In accordance with legislation here, there is a list of conditions and diseases where medical cannabis can be prescribed by the doctors, and PTSD is not included. Of course, there are some oncological states, chronic pain condition, epilepsy, and something like this, which is used internationally, and the same applies for Ukrainian legislation now. This was a great storm of hate, like you're not treating PTSD with marijuana, how could you? Well, we did not expect it to happen, and that's fine. Is that all?